Looking for a professional office space that makes it easy to focus on growing your business? At J. Kenba Executive Suites, we offer turnkey office solutions with stylish furnishings already in place so you can walk in and get right to work. Our leases include access to Wi-Fi, managed building access for security, on-site parking, utilities, and regular cleaning services, giving you peace of mind and a workspace that's always clean, secure, and business-ready. Whether you're a mental health professional, insurance agent, notary, or other service-based entrepreneur, we provide the professional environment and amenities you need to impress clients and operate efficiently. And if you're not looking for full-time office space but need a place to host a workshop or small meeting, we also offer conference room rentals, perfect for off-site meetings, trainings, and workshops. Schedule your private tour today and see the difference for yourself. Visit jkenba.com. That's www.jkenba.com to learn more and reserve your space before it's gone. At J. Kenba Executive Suites, we provide the professional space. You create the success.
Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kenba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. And we are back yet again, surprising to some, but kind of exciting for some others. I'd say when we're able to come back for another episode, people oftentimes, get really, really excited that we are doing something from a longitudinal standpoint, but they're also sometimes really shocked that we are somehow still going. And I think that's a good thing for the haters out there, just to say, hey, keep hating. Yeah, we're not going anywhere. So when I say the term we, of course, I'm Dr. Jasper, one of the hosts / co-hosts of the Byja radio show. And if I'm saying we, after the idea of me being a host or co-host, that must mean I'm sitting next to the illustrious, stupendous, magnificent, highly favored, and always blessed Patient Zero. How you doing today, brother?
Man, brother, I'm doing fantastic, man. Anytime I get to talk about some medical stuff with you and it's not about my own diagnosis, it's a good day.
Diagnoses. Let's go there, because it's got to be more than one, right? I can't just give you one. I got to give you at least three.
You got to give me multiple. I'm like, man, all this stuff wrong with me? But hey, I'm determined, man. I'm going to make it to 117.
There you go. I like the number. Solid number.
Yep.
So we are coming in for, I believe, episode 32. I'm pretty sure we are nearing the finale of season 3. Which again, as I alluded to in the earlier part of the intro, that, hey, we are here and here to stay for quite some time because we are gaining some momentum. And in order to gain momentum, I think you got to have good content. Obviously, you want to be entertaining because we're in an entertainment space, even though we're in a media seat. But what I am also noticing that a lot of people don't realize is that a lot of times we don't have to really think hard for content, my friend.
No.
It kind of writes itself. Because this morning, as I am doing my usual morning routine, I am sitting there reading, and as I'm reading, I see a news story that basically says something along the lines of somebody in the federal government is trying to ban independent medical journals. And at that point, I literally just put my head down, only because I said, I don't even have to think that hard to figure out what we're going to talk about for this episode, because that is just basically like let's go old school, like when they used to lob the ball to you and you were playing t-ball or baseball. It was the underhanded pitch. That's what I'm looking for.
Yeah.
It was just to the point, like, I'm like, this is just too easy at this point. Like, we are a medical show. We definitely try to keep people entertained. But at that point, I was like, I don't have to write anything. Like, no. I don't have to think about it. I just know we're going to talk about this. So today we're going to talk about not only that topic, but we're going to potentially frame it in the idea of how medical mistrust has been a thing for a while. And a lot of it, people don't understand that it can come from exactly this seed that may be planted in that, hey, look, those medical journals that you all potentially think are really good, well, we really don't think you should read them. We should make our own in the government. And the government makes some, if the government makes their own medical journal, somehow it's going to be much better. And I don't think people really understand, possibly grasp what all this means. So we're going to definitely talk about it. So I'll start by just throwing it to you, Patient Zero. So when you hear that topic, and again, I can frame it a little more if you need me to, but just ideally, when you hear a topic of somebody saying, you don't need independent medical journals, we're going to do government journals instead. What are you thinking?
Well, I think the first thing I think of is trying to control the narrative.
There you go.
Anytime that you have, and the beautiful thing about our country and about democracy is just anybody could say whatever they want to say. Everybody has the right to an opinion, especially when you've done the research and you've done the work, and you have something that's competitive. You should be able to compete, whether that's a product, whether that's some type of media, whether that's something written, where people should be able to read it and judge for themselves what's fact or fiction. And when you start to ban these type of things, it almost feels like the government is pushing some type of narrative on you, right? And so, it could start mistrust, right? So, and then we talked about health disparities on a few episodes.
More than a few. Yeah. I'm pretty sure it's almost one of our calling cards, but yes. At
this point, right? And then you can, to me, that's the other side of that coin, because you can talk about access in healthcare, who has it, who doesn't have it, but you can have all the access in the world, and if you don't trust it,
there you go.
You're not going to utilize it.
You cooking today, man. You cooking, and we just getting started. So let me give people.
I made some grits this morning too, boy.
Again, we're going to stay away from food-based topics because we could easily go left on that one. As you know, grits are delicious, by the way. If you're in the North, I don't know what to say.
Don't put sugar on it.
I'm just going to say I don't know what to say because some people don't actually know what grits are. And I've had that conversation before.
Wow.
Yes. In different medical settings. It is literally where people do not know what grits are.
That's wild.
Again,
before we move on,
it's a Southern thing. It's a Southern thing.
Before we move on, I wouldn't have made it to 40 without grits. I promise you.
All I'm going to say is if you say you wouldn't have made it, I'm not going to judge that. But if you say you're putting butter on them, I don't know if you're going to make it past for it. You keep on doing it.
Hey, butter and cheese. And according to my physician, I'm in great health.
Who is that guy? All right. Based off of that, we are literally going to give you a little bit more insight what we mean about this kind of government approach of possibly eliminating those independent medical journals. So in May of 2025, as we are recording this episode, the U.S. Health Secretary Robert F. Kennedy Jr. proposed banning federal scientists from publishing in established medical journals, specifically journals like the New England Journal of Medicine, the Journal of the American Medical Association, and other journals that may not necessarily come to mind because I'm a family doc. I'm going to plug us, the American Family Physician Journal. So these are pretty significant journals in different walks for different reasons, and we'll kind of give you more information about them. But with those types of journals, federal scientists couldn't publish in them. They're only somehow going to be regulated in publishing in basically state-run journals or government-led journals. So with that, obviously, that comes with a lot of red flags, especially if you're a pretty independent, well-rounded person of how the people who are potentially cutting your check are going to now influence what you're going to say and not say. And we know what that can be. But we're going to go a little bit deeper into the information about these types of journals. Because what I think people hear is so-and-so says, well, we don't want you to read or put something in these journals. And the reason they say they don't want you to do it is because of X. And because of that, people just listen, right? Mm-hmm. Okay, they said it. They must say it for a reason. I trust what he's saying, so therefore, let me go ahead and run with it. Well, let's talk more about the journals and kind of frame again why they're saying that. So RFK Jr. said that these journals are corrupt and suggested replacing them again with government-controlled alternatives, a move that to us, especially me, threatens medical independence, scientific integrity, and public trust. So what does all that mean? Well, let's talk about what are peer-reviewed journals, okay? So, George, I got some things in front of you that I put down on paper because I wanted you to take a look. So, we're going to talk about peer-reviewed journals in the United States, okay? Peer-reviewed journals. There are plenty of them, but we're going to focus on a few. And I got some information in there about the 3 journals that I think we're going to reference. I already talked about one, the New England Journal of Medicine. the Journal of the American Medical Association, a lot of people call it JAMA, and then the American Family Physician Journal, okay? So based off of that, let's give the people some information about these journals that are potentially corrupt and give background on what they are, when they started, things like that. So if you go down the list, you'll start to see, and we'll kind of go line by line, okay? So let's start with the New England Journal of Medicine, okay? You'll see it often written as NEJM. So in the New England Journal of Medicine, let's go through who's it for, when was it established, things like that. So George, what you got?
So the New England Journal of Medicine was established in 1812.
So that was yesterday, obviously.
Yeah,
clearly.
Just the other day.
Yeah, it's easily.
No credibility.
Yeah, none whatsoever. Not even 100 years. Not even, right? Clearly it's 10 days old.
Yeah. Breaking news. The New England Journal of Medicine reported, they broke the news where we eradicated polio.
Yeah, it's a possibility. It's a possibility. And again, as we go, you might be surprised about what you're saying. So continue. Let's talk about the audience.
The audience is for physicians and researchers.
Right. So it's a journal of medical information written by people in research and physicians for physicians and researchers. Okay. So again, peer reviewed, right? Yeah. You are writing something to your peers. It's not necessarily for the general public, but you can definitely get your hands on it and read it. Sometimes it's a little bit more involved. But let's talk about key contributions for the New England Journal. And again, there are many, but I just put one down recently because I know it's going to raise some red flags, but we'll kind of go into this a little later. But what is the key contribution that you would see with the New England Journal?
They were the first to publish major COVID-19 vaccine trials and a lead in clinical trial reporting.
Okay. So regardless if you like vaccines or you don't, the second part of that sentence is the part that I want people to focus on. They lead the basic, for lack of a better term, medical world in clinical trial reporting. That's not just vaccines. That's HIV. That's blood pressure. That's dialysis patients. That's stroke. That's heart disease. That is infections. That is integrity-based things like ethics, bioethics. All these subjects that I can throw out over and over, there is pretty much the standard of if you can get in the New England Journal, you've pretty much made it, right? Like your research is that good, that solid. The data or the evidence-based information we're putting out is so high quality that you made it into this journal. It's a pretty big deal. Okay, so we're going to start with that one. So again, established in 1812, basically written for physicians and researchers by physicians and researchers, and they have a lot of stuff that they've done as kind of that, for lack of a better term, gold standard. Okay, we're going to go to the next one. So let's go to JAMA. What do you got with JAMA?
The JAMA is an acronym for the Journal of the American Medical Association, and this one was established in 1883. I'm pretty sure that was the year the Louisiana Purchase, if it is close.
Yeah,
something like that.
I'm pretty sure.
But that's a long time.
There you go. Pretty long time.
Its audience is for physicians and policymakers.
Correct. A little bit different.
Yeah.
Right?
But that's still huge.
Pretty big, right?
Yeah.
And what are the key contributions you got?
They influence national guidelines. They publish on disparities, ethics, policy, and innovation. Okay. So I'd say that's very important.
Pretty important, okay? And we're going to do one for the home team because you're sitting with a family medicine doctor, so I have to talk about that. Again, if you're a specialist in another area, I'm sure you have your own journal, but if you want to talk about your journal, get your own show. Okay, go ahead.
I mean, Becnel Media might be able to record that show.
Might be. I'm pretty safe to say he can do a really good job. I'm going to go ahead and say that.
Yeah, so the last one, like you said, the American Family Physician, it was established in 1950, kind of the baby of the group. However, 1950, that's still 75 years.
Small 75.
Yeah,
small 75.
Long time.
Yeah.
Audiences, obviously, family medicine clinicians, right? And their key contributions are clinical guidance for the frontline care, highly practical and evidence-based articles.
Right. So again, you are in a specific medical field. You tend to get your own medical journal written for your field. But there are some that are a lot more broad, like the New England Journal has information pretty much on every field. Mm-hmm. The JAMA JAMA magazine or publication may have information across every field, whereas American Family Physician is going to be probably more family physician focused.
Sure.
There may be an article for the pediatric field, for the pulmonology field, for the neurology field, right? Mm-hmm. So these different journals have different basic ways that they focus, things that they really look at. But the thing that most people don't realize is they are, again, peer reviewed, meaning whoever we're writing for are often the same people who are doing the writing, right? Most people who are writing may be writing about policy, but they have a policy background, right? They're writing about ethics. They have an ethics background. It's not someone saying, well, I woke up on Tuesday. I decided to write about ethics when I have no background in it, because even if you did, it has to pass a certain level of credibility, integrity to get into the journal. So it's not that you can't write it, but you can't get it published. Hence, the standard is so high to often get into these journals that people don't realize it. Now, I'm a pretty smart guy, depending on the day and depending on who we're talking to. But most people that I know usually consider me to be one of the smart people they know. Okay.
Sure.
I bring that up to say, do you have an idea how many publications I have in a medical journal?
You, as Dr. Jasper.
As Dr. Jasper.
I'm going to say 17.
Okay. You are a very, very good friend. I'm going to say that. One.
Oh, you have one.
One publication.
So you got 16 more to go.
A strong 16. Okay. And I'm not saying that it's not going to happen, but I usually say stuff like, if you believe that, I got some swampland for sale in New York City. So with that being said, it is not easy to do. That one journal article that I was able to get published in a medical journal took a lot of work. And it also took me working with 3 other doctors. Okay. Collaboration against different institutions with me doing it. And when I was published, I was really happy because it was something that I didn't think I would ever do because it wasn't my cup of tea. But the fact that I was able to talk about that in that way in a thorough manner with the help of other people, we were able to get it published. So I bring that up to say, this is not something that's small potatoes. This is something that's really, really important. So based off of that, let's talk about what makes something peer reviewed. So we kind of already alluded to it once again, but peer review is a rigorous multi-stage process where submitted studies are reviewed by independent experts in the same field. We kind of already said that, right?
Sure.
They're evaluated for a few different things, but the ones that stand out are the methodological soundness. How sound is your methodology?
Right.
I always try to butcher that word, but how sound is your methodology? Your ethical design, something called IRB approval and informed consent, which is a huge thing. The statistical validity, meaning is it a statistically valid study, or is it just something that sounds good, or is attention grabbing, or it's something that is clickbait, as people would say. Then, is it reproducible, and is it subject to revision, rejection, or editorial scrutiny, which is a huge part. Okay, so again, it's not just one of those; it's all of those. You have to potentially check all those boxes to get into a place where they say, this is good, we want to publish it. Now, some journal articles are a little bit better than others, obviously. Some journals are a lot more difficult to get into and get a publication. But the point is, all of these things tend to be checked and checked and checked and checked and checked again by medical experts in their respective fields. And then when all of that is met, it's then again published, okay? Last thing I'm going to say is that only 10 to 20% of submissions to the top journals like the New England Journal of Medicine or JAMA are accepted. 10 to 20%. Okay. Again, that may sound like a lot where you say, well, we have 100 articles and only 20 are accepted. Some people may think that's a lot, but to me, I think that's pretty low because that's a high threshold to be one of 20 out of 100.
Sure.
Now, that being said, the AFP or American Family Physician, the acceptance rate is estimated at less than 25%. So all of this reflects strong editorial standards that ensures clinical applicability and relevance to medicine. Okay. All that being said in big words is that these standards are not scrupulous or unscrupulous, I should say. These standards are not things that are just basically thrown around where you just can publish because you thought it was a good idea and you just wrote some stuff down and you know a guy who knows a guy. Doesn't work like that. Now, if it does, I'm sure it's happened. Not going to say it never can, but I'm pretty sure it's a lot easier to publish in other publications than it is to publish in medical journals. Okay. Now, with that being said, I want to go into the opposite end of the pool. So we just went on the medical journal side. So George, I'm going to give you the news article and op-ed side. So where people are writing for news outlets and things of that nature. So What is the difference or the contrasting opinion when it comes to news articles versus medical journals, if you don't mind?
Well, when you talk about news articles, they're not peer reviewed. They're often written by non-experts. You don't have to have any credentials to write it. Like I can write a medical article for the news. I wouldn't recommend reading it.
I would. I'm pretty sure it would be hilarious. Okay.
Hey, man, they might have some gems in it.
There you go. There you go.
But, it's published within hours or days without extensive vetting and is prone to editorial bias or incomplete medical content. Or context, excuse me. So, I just think a couple of things, right? Just after listening to this.
Yeah.
Number one, RFK must be rolling over in his grave at how wild his son is, because there's a couple of things, that's bothering me about all this content. Number one, the strenuous vetting process it takes to get something published in a medical journal shouldn't be ignored.
Correct.
And that's a big deal. But even in something that's media, in the media that's not vetted as much, all that stuff should be okay. It's up to other people and the readers to determine whether what I'm reading is worthy enough of my attention. You have that right.
Correct.
So when you're talking about limiting who can publish what, it just comes off as very controlling, and you want to push your own narrative, and I just hate that.
Yeah, absolutely. And I think the other part for me, and I'll say this briefly, is that it comes down to who do you want to listen to? Do you want to listen to somebody who's been studying and going deep into the weeds, doing it for a long time, dotting all the I's, crossing all the T's, getting it vetted and vetted and vetted by their own team first before they even go to the journal? Or do you want to go to somebody who literally said, hey, I asked a few people, this is what they said, and this is what I'm going to write.
Right.
And it sounds sensationalized enough that people are going to read it, so I'm doing something good. Even though you're not really spreading good information, you're spreading stuff that sounds nice or, again, is clickbait, as I'll keep saying, because it's easy to understand, that you just want people to click on it to read, and it doesn't make any sense. It doesn't have anything that really can stand and withstand the test of medical professionals, right? I'm basically putting something out that's going to get people who I want to attract to come over, basically reinforce what I'm saying, even though it doesn't pass those standards. So that's the part that really bothered me when I saw it, because I said, here we go. And all it's going to do is just reinforce the mistrust that people tend to have, which we'll talk about what that comes into or where it comes from. But that literally is going to be what it starts to do. It's just going to start a huge cycle of, well, we can't trust them because they're not in the quote unquote government journal. But the government journal is influenced by people who are higher up, and it's not peer reviewed. It's not anybody who's really and truthfully, ethically sitting there and saying this is not right. It's literally just people who are in power doing what they can do to influence what is or what isn't considered real. And that's not true, because in medicine, we go off of science and data and something that's called evidence, meaning it can be reproduced over and over and over again. It's not something that sounded good and you have a story or an anecdote about a cousin or a friend or a neighbor, and you can't really and truthfully reproduce this against 1,000 people, 10,000 people, 1,000,000 people. It's something that you heard one time and you just choose to believe it. That's not science. That's not evidence-based. So that's not what we're going to do. So in this point, we're going to almost close out this part of the segment by talking about something called retraction rates. So retraction rates are basically what it sounds like. It's when an article is written, and when that article is written, what you're doing is saying, hey, we made a mistake. Let's go ahead and retract it and put out the real information, or retract it and put out the information that is credible because we made a mistake, or something that we thought to be true needs to be updated and removed, right? So a lot of people don't do that, but we're going to talk about how medical journals do. So when we come to retraction rates, the New England Journal of Medicine has a retraction rate of 0.03%. 0.03%. So less than 0.1% is retracted from the New England Journal.
So out of every 10,000 articles, 3 are retracted.
Just 3. Strong 3. Great number, by the way.
Great number.
Right? So that is among the lowest in the world.
Looks good on the shirt, by the way.
Yeah, solid.
Yeah.
But less than 0.1% are retracted from that journal. In JAMA, the retraction rate is approximately 0.04%. So again, it is very similar to the New England Journal, but it literally is them saying, we got it wrong. Let's fix it. So somebody came and pointed out where we made a mistake. We're going to fix it. Now, all of those things don't tend to happen on a regular basis. Now, we're going to jump to the other side of the coin, or other side of the yard, other side of the pool. So, George, I did the medical side. If you're looking at the news side of things, what do you think their retraction rate could be?
On the news side, their retraction rates, I tell you what, it's probably a lot higher.
Well, I'll give you a spoiler alert. They don't really keep track of it.
Yeah, I'm about to say, I didn't think so.
Right. So at this point,
and the reason why, there's some respected news outlets in Baton Rouge. I don't want to call their names because I don't feel like getting sued. Yeah. But, just news that I keep up with, and I read an article and it says, edited at such and such time. It'll give the time that it's published, and then it'll give the time that it was edited.
Yeah.
Because they constantly updating the article. But it's almost every article that you read.
Right. And why is that a problem? Depends on when you read it.
Right.
If you read it and you didn't have a retraction put out that says the last thing that we published was wrong, this is the more updated version of that article. Ignore the old one. This is the updated one. That is different than we just took the first story, we edited it, we put a little line at the bottom. So the first person who read it thinks that what they read 2 days ago, a week ago, a month ago is the same, but didn't go back and read it again, as opposed to a retraction where it's literally publishing the thing that you got wrong and putting that out as a separate publication. That's the whole point of it being ethical and holding yourself accountable, or having other people hold you accountable, rather than, hey, let me just make some edits, right? Sure. I wrote a text message. It said, I'm going to be there at 5. And then when you're not looking, I changed it and said, I'm going to be there at 5:45. And all of a sudden, you're like, well, I just edited it. Well, that's not the same thing as you called me and told me I made a mistake. Let me go ahead and correct it. So you are knowledgeable. I'm knowledgeable that I'm coming late, or I'm not going to be there at the time I said. That's a different thing than, well, I just edited the text message. I hope you went back and read it.
1,000%.
Right. So it has to be a little bit more insightful in the approach on the medical journal side than in a typical news outlet side of things. Right. It's often literally no database to track the retractions. And more importantly, it can be inconsistent. And it can be voluntary. You don't have to do it unless you really want to, or unless somebody forces your hand. But with the peer-reviewed medical journals, it's done in a way that people tend to have a accountability for themselves. So based off of that, I'll wrap up this part of the segment by saying one specific thing. There are other journals outside of the U.S. that hold themselves to a similar standard within the U.S. There's the BMJ, the British Medical Journal for the UK. The Lancet is also from the UK. There's things like the Canadian Medical Association Journal. All these journals put out medical literature and data in a similar fashion. And all of a sudden, the U.S. is going to go away from the actual standard and become different. And some people may say that's a good thing. Well, again, it could be, but it also could be a very bad thing if you are now breaking from the norm, where you're literally saying your independent researchers, doctors, physicians, and things that are in that medical space are no longer credible unless they're in this government thing. It literally just starts to put a wedge between the medical community and the actual public, because now people are going to have even more of a mistrust for the medical community because the government is now involved. And that is never a good thing. We need to have data transparency. We need to have those conflict of interest disclosures. All of that is in medical journals, because we literally have that publication where you can see the statistics and do your own statistical analysis. It's not just, this is a stat. Where'd you get the numbers from? I just made it up. Or you don't have any idea where it came from. They publish the statistics and tell you how they did the research, so you can go and do it again. And if it's reproducible, you know it's valid. But that's why people don't understand that, because, again, people just tend to think, so-and-so said it, so I'm just going to take it as gold. If you don't believe me, pick up a New England Journal, pick up JAMA, read through those articles, and I guarantee you would say, oh, this is way more than I thought it was. And it's very story-oriented, but not quite as simple. But once you learn how to read it, it's really easy to follow. Okay. So based off of that, I could go on, but we're going to take a quick break and come back right after this. Hello there, it's Dr. Jasper from the Byja radio show. Are you tired of the broken healthcare system? Frustrated by long wait times to see your physician, rush visits, and the sky-high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today. So coming back in from the first segment, which I think was a pretty spirited discussion.
I agree.
I think overall, if you listen to the whole first segment, you kind of see where we're sitting in the seat of not only trying to somewhat entertain, like we're not over here doing quote unquote breaking news or anything like that, but what we're trying to do is inform people of why certain things that are being put out and published are very important, not to just sit back and take it as, oh, that's problems over there. This is going to affect you in a very roundabout way, but it's going to affect you.
1,000%.
Right? So I think I'll just kind of tie it back into segment one and go to segment two to say that if you are dismissing medical journals as being corrupt, it's ignoring the very systems that's designed to prevent corruption. I'll say that again. If you are dismissing a medical journal as being corrupt, it's actually ignoring the systems that are put in place to prevent corruption.
Yeah,
right?
absolutely.
And it doesn't make sense, right? It's basically trying to undo something that's preventing corruption by calling it corrupt. It's just it's a trick, and it's basically smoke and mirrors. So even though we know peer review stuff isn't perfect, it's far more accountable than things like political opinion pieces, viral posts, and propaganda, right? Disguised to be medical science and pseudoscience and all that other stuff. If you have a really good journal with a really good study, with a lot of good data, you can easily figure it out by looking at it, doing your own study, statistical analysis, like doing it all over again. And if it's there more than once and reproducible over and over, that's science. That's how science works. It's not a flash in the pan one time, so-and-so said it, it sounded good, I'm gonna run with it. It's been proven repeatedly. And now that it's proven, this is where we're going with. Not saying that it's 100%, but it's actually pretty high.
Yeah.
Okay? So based off of that, we're gonna go into segment two. And segment two is basically talking about how those types of things in the world of taking away medical journals that are peer reviewed and going with state-led or government-led review articles for certain people in the federal government can just lead to more medical mistrust. And how do we do that? Well, we go back and look at things that have caused medical mistrust. I think that's a pretty easy segment to kind of go into. So George, we'll talk about a few different things, right? So basically in segment one, we talked about how those independent scientific voices are often discredited or silenced. And it can be done in a number of ways. Different countries have had it, like the Soviet Union, things like that. And from those types of countries, basically ended up being very horrible. And then things crumbled, and then they had to start all over again. So we're trying to hopefully inform people we don't want to go down that road.
Right.
So what are these things that we're trying to prevent? Well, when you don't have those guardrails in place, people are often reduced to things like test subjects. Communities are lied to or excluded when it comes to medical breakthroughs. And then more importantly, patients basically are exploited for different things. Their bodies are exploited, their minds are exploited, their health is exploited. And that's horrible. But I'm not just saying that because it sounds nice. I'm saying it because it's been proven and it's happened over and over and over again in the medical community in this field. So I'm going to start by giving a story or giving some background. George, I'm going to throw some questions your way. And then I'm going to turn it over to you and let you do the next one, if that's okay.
That's fine.
All right. So do you happen to know who Dr. J. Marion Sims is?
I do.
Okay. Now, do you want to tell people why you know who Dr. J. Marion Sims is?
Actually, I had seen a story on this person before.
Yep. Some people know.
Yeah.
But that's why I wanted to at least frame it, because some people literally know it like the back of their hand.
Yeah.
A lot of people don't, especially males. Right. And females know, and as we talk about it, you'll probably understand why, but males usually don't. So I'm impressed with you, brother. Let me just go ahead and start there.
I appreciate that.
Okay. So with that, now that you said you've seen a story about it and whatnot, do you want to give the listeners an idea of what area did Dr. Sims practice?
He was gynecologist.
Gynecologist, right? He was called the father of modern gynecology.
That's wild.
The father of modern gynecology. Sounds very prestigious, right? Very, 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 very noble.
I love how he gets this noble credit.
Oh my goodness. Super noble, right? So this gentleman basically did a lot of medical care in the 1840s. Okay. Now, for reference, when was the New England Journal established? 1812.
Yeah.
Okay. So again, the guy who's the father of modern gynecology was practicing after the New England Journal had been published. So that goes to show you the standard that I'm talking about.
Yep.
But within J. Marion Sims, he basically operated on enslaved black women to advance the field of gynecology, often with no anesthesia. I'm gonna let that sink in.
That's wild.
I mean, if you're listening, if you feel uncomfortable, good. Because I want you to think about what those people felt.
Bro, like, so
gynecological surgery with no anesthesia.
I'm going to say this, and I mean this in the most serious way possible. I got a tattoo, and I use numbing cream to get the tattoo. Mm-hmm. It's a tattoo.
Yeah.
It's not surgery.
Right. Superficial at best, right?
Yeah. Surgery.
Correct.
These ladies had nothing.
Correct. Nothing.
That's insane.
Nothing. I'll go one step further. Dr. Sims published his own autobiography where he talked about doing this. This is not Dr. Jasper making it up or George making it up. This is something that has been written about in his own autobiography. And he talked about performing at least 30 surgeries that were experimental on black enslaved women from 1845 to 1849. And he named roughly 3 of them. One was named Lucy, one was named Betsy, and the one who potentially had it the worst was named, and I hope I don't butcher this, Anarcha. Anarcha had at least 30 surgeries by herself. 30 surgeries with no anesthesia. Okay? With that being said, there was no formal medical ethics review boards that existed at the time. Okay? So we just talked about what? Peer-reviewed, and obviously having ethical standards and having a high standard. There were none. Okay, that's the first thing. And on top of that, of course, we already know enslaved people had no legal standing, so there were no repercussions, and they couldn't refuse. So with that being said, this gentleman had the ability to do things with unchecked authority in the medical field, even though there was a New England Journal that had been started several decades before. No one, for the most part, was checking authority in this way. So you could kind of go off and do stuff unhinged and then get credit for it when people suffered and have a title bestowed upon you that somehow literally gives you this noble sounding thing. Well, the father of modern gynecology, when this person was doing some underhand stuff. And I always remember this because most people know this. My wife is an OBGYN, and they have a tool in surgery named after this man. To this day, 2025, there is a tool named after him used in surgery because, quote unquote, he did this. Now, shout out to my wife. She doesn't call it by that name. She calls it something else. And I said, you're damn right.
Yes, she should.
There you go. So with that.
Yes, she should. Man, you know what this reminds me of? This reminds me of all these Confederate streets and Confederate monuments. Like, they should rename the tool too.
Yeah.
You know, if Jeff Davis Parkway could now be Norman C. Francis
Parkway. Shout out to our frat brother.
Yeah, good frat brother.
Yeah, absolutely.
Brought the Saints here.
Yeah.
But yeah. So if that's possible, rename the tool, bro.
Yeah. So that being said, this is just one story. And when I say one story, one example of how medical mistrust can start and continue, because you can imagine that this person who's out touting all his achievements didn't give people the idea that, well, I did have to kind of go and basically dehumanize people, do things in an immoral way to get to this standard.
Yeah.
But I want you to trust me because guess what? I'm not corrupt. I mean, I'm here.
It was all in the name of
Science, right? So it's not corrupt what I did, but the people who are telling you what I'm doing is corrupt. They are corrupt, right? Like it's, I'm not crying, you're crying, right? That kind of thing, right? So that's the whole idea, and that's just one example. So we're going to go to example number 2. We got 4 total, okay? So George, the next one I'm going to give to you is in a similar fashion, similar idea, but a little bit different, right? So we were in the 1800s. We're now going to move to the 1900s. So what are we talking about next, George?
Oh, my God. These notes, man, wow. We're talking about government-sanctioned forced sterilizations.
Okay. Say that one more time for the people in the back, please.
Government-sanctioned forced sterilizations.
Okay. All right.
So the government made people be sterilized.
Okay. And let's be more specific, because you may say, what do you mean? There were 32 states that passed laws targeting people who were deemed to be unfit to have children, and basically made it legal for them to be sterilized, starting in 1907, to be exact. And this went on for at least 6 decades.
We're up to 1979.
At least 6.
So my parents graduated high school in like 71, 72.
Okay. So I want you to think about that.
Like that's the other day. Like I was born in 85.
32 states made it legal.
And I'm sure Louisiana was one of them.
Yeah, I'm not going to say. You can look it up. If you're a listener, go ahead and look it up. Over 60,000 forced sterilizations were documented across the United States. California was the leader with over 20,000, which was 1 in 3 people.
Yeah.
And then on top of that, North Carolina sterilized nearly 7,600 people. Most of them were poor black women. Okay? With that, in 1973, a study showed that 1 in 5 Native American women had been sterilized without consent by the Indian Health Service. So that's another example of how you don't have guardrails in place in a medical community. Things can go. And even if you have quote unquote guardrails with the what? Government, it's going to somehow magically be okay because the government is doing things. It must be good. That's not true. You need to have people outside who are going to potentially have the authority to check people from doing things that are not what? Ethical. So based off of that, that's a second example. And again, we could go into more detail, but we're trying to hit the high points to show you that this is not a one and done. It's not a 2 and through. This is going to continue until we hopefully say, hey, enough is enough. Let's do something different, right?
1979.
1979. So speaking of the 70s, we got another beautiful one for you. I'm sure you know this one.
Oh, 1,000%.
So starting in 1932, all the way through to 1972, there was something called the Tuskegee Syphilis Study. And with the Tuskegee Syphilis Study, this was authorized by the United States Public Health Service. That is the predecessor to the CDC. So back then, they were basically having a deal with the then Tuskegee Institute, where they basically enrolled 600 black males and gave them the idea that they were going to receive free treatment where they potentially had syphilis. And with that, we just basically sat back and watched them. 399 men had syphilis, 201 did not. That's what we call the control group. Control group is the people who don't have something, while the other people are getting the quote unquote treatment or disease. With the 399 people, they watched them and track their progression of untreated syphilis, never informing men of their diagnosis. Okay? They didn't tell them they had syphilis. They told them they were getting free treatment. They injected them with syphilis and gave it to them, and then watched them get sick to then quote unquote study the disease for 40 years. The best part, and when I say best, I'm being very, very sarcastic, they literally had the treatment that came out in 1947. So 15 years into the study, when they got the treatment, which is penicillin, they did not tell the people penicillin existed. Penicillin is something that we can do to actually treat your disease so you don't have to get sicker. They just sat back and watched and kept the treatment a secret as these people continued to get sick and then, of course, pass away. Of that, 128 participants died directly from syphilis or related complications. 40 spouses of these men were infected, and 19 children were born with what we call congenital syphilis. You know how despicable you have to be to treat black men like that? They're their spouses, and then their children, and then sit there and think that's okay. And all of that was given to them. And what did they get for that study? The promise of free food, burial insurance, and no informed consent or ethical guidelines. And this is with the consent of the what? Government. Okay? Yep. And that's why I'm trying to get people to understand that this is not just us sitting here trying to basically wave the flag and say, well, this administration. No, we're not doing that. We're not saying that anybody is above reproach. I don't care what side of the aisle you're on. If wrong is wrong, then that's what I'm going to stand by, because that's what I went to medical school for, to do right by people, not right by this color person or this religious belief or this faith-based thought or this person who lives in this zip code. When they come here, they're people first. And when that happens, that turns into what? People getting better because you treat them as such. This is not treating people as such. And this is basically giving people what? The unchecked authority, and there is no what? Credibility being told that, we need to actually have. We just can do what we want. Okay. And then the very last one. So the story number 4. And George, I see the disgust. I'm sorry I have to walk you through this, my friend. We're almost to the finish line. Okay. Let's talk about story number 4. What you got?
So, this is another story that I saw a while ago. Henrietta Lacks and the HeLa cell line. So apparently,
what year? Let's start there.
1951.
Okay. All right. So again, we were in the 1800s. We got to the early 1900s. We got to the, for lack of a better term, midpoint of the early 1900s, 1930s, right? Mm-hmm. And now we're in 1950. Okay. So again, this is almost within 100-year span. 100 years. Like, we didn't have to go back even further. We went from 1845 and we're now at 1950. Just to put it into perspective, like, these aren't random things. I'm not saying let's just pick random. No, this is 100 years, just 100. Okay. And we're, again, 75 years past this point. But let's talk about Henrietta Lacks. What happened with her?
So,
and I'm sorry, one more. Where did it happen?
Johns Hopkins Hospital in Baltimore, Maryland.
Pretty prestigious hospital.
It's a very prestigious hospital. Okay. Like, I've never been interested in the medical industry at all, but I know what Johns Hopkins is.
Yeah,
because it's kind of up there with like MD Anderson's and
Byja Clinic.
That's
what I'm saying. I knew that's what you were going to say.
Yeah. I got a Byja Clinic T-shirt, by the way.
Yeah, I mean,
looks good.
We're trying to swag it out.
Yeah.
Okay.
But so she goes to Johns Hopkins Hospital. George Gay, I guess, was her physician, and she had cervical cancer. So during her cancer treatment, tissue samples were taken from her without her knowledge or consent. So apparently her cells were found to be uniquely durable and
able to be replicated.
Able to be replicated, correct, as the first quote unquote immortal human cell line. So known as the HeLa cells, they became the foundation for countless medical breakthroughs. So they used this lady's cells to in 75,000 studies worldwide. 75,000, and enabled the development of the polio vaccine, HPV vaccines, cancer treatments, in vitro fertilization, AIDS research,
and so much more,
and countless other things. And despite widespread use and profit by big pharma and some of these research institutions, her family receives no recognition or compensation until decades later.
Okay, so let's be as specific as possible. 1951, she has cancer. They take her cells without her permission, without telling her. Two different things, right? Hey, you could tell me and do it anyway, or you could not do it and try to get consent. So they did both. They didn't tell her and they didn't consent her, right? After they take her cells, they figure out we struck gold. These cells are really, really good. They're durable. They can replicate over and over, so we can constantly advance research without having to keep testing and getting cells from people. Like, we don't have to keep biopsying and getting more cells from a different person. They used one person's cells that were really, really good and unique, and basically started to do a ton of research that basically led to a lot of medical breakthroughs. So people may say, well, that's a good thing, right? It is in a way. But the problem is what if she didn't want that?
Yeah, she was treated inhumane.
What if she said, I don't want you testing anything on me. I have a right to do what I feel is comfortable. And I'll give you an example. If you are listening and you don't want to get a vaccine,
You don't have to.
you have the right
Right.
to not get a vaccine. Now, people may not like it, but at this point, you have the right.
Right. It's your body.
You can do what you want. This lady didn't have that. And that's the issue we're trying to get to. It's not saying that everything is perfect and one group is right and one group is... I'm not saying that. What I'm saying is if you are going to stand on the hill of saying certain things should be done without a shadow of a doubt and then turn around and say, well, these people don't really get that. That's where the problem lies. And that's where the ethical part comes in and the standards come in, where we're trying to say this is how the standard must be met. And when that threshold is crossed, then we can talk more. But until then, we're not even getting into it because at this point, it's not meeting the standard. Right now, there was no standard when we were in 1950. You just kind of did what you want. And even if there was a standard, oftentimes the government said, yeah, there's a standard. We're just going to still do what we want anyway. So then at that point, you don't have a way to trust the information you're getting, both from a government and a medical side of things, because what? It's been 100 years of stuff like this happening. From 1845 to 1951. It's 100 years of stuff like this happening.
And these are things that we know about.
And we know of, right? And with that, all of the people who are benefiting are often people who don't go through all of the hell, right? The black women who had operations by Marion J. Sims didn't benefit. They had surgery with no anesthesia, and the people who got the surgeries that quote unquote worked had anesthesia. So you're using people to benefit other people. Henrietta Lacks was used to benefit other people. The men in the Tuskegee experiment were used to benefit other people. And then the sterilizations were used and completed to benefit other people. So this is the problem that we continue to happen. And if the people get to do this with unchecked authority, it's just going to happen all over again. And that's where the medical mistrust stems from. With that being said, let alone all that happens, then you're not compensated fairly when it actually is brought to light. That's even more of a slap in the face. And that's unfortunate, but that's what happens. So all of that being said, we are telling you how the story of, hey, let's go ahead and eliminate these independent peer-reviewed medical journals may not sound like a big deal, but if these 4 examples can inform you of what can happen when unchecked authority is happening, there are no peer reviews, there are no IRB approvals, which is basically internal review boards, if I remember correctly, which is basically the boards that review the ethical standards of medical studies. And if you don't pass IRB approval, you can't do the study. And that has to come with a certain set of standards. Then you have to do this in a way where if you want the world to know that these things are legit, you have to pass another set of standards to get into those journals like the New England Journal and JAMA. All of that being said, if that's what's happening, then I feel a lot better that in the 1980s, when a lot of this stuff started to actually shift, where all of these ethical standards started to be put in place, IRB approvals and things of that, then medicine started to be less politicized and more independent. When it was less politicized, more independent, you started to have a lot more benefit on different things. Now, again, it can go both ways. I can understand how people say, well, if we make it all independent, that's going to be perfect. Well, I'm not going to say that that's perfect either. You got to basically have some balance on both sides, right? Yeah. All that being said, we're trying to get into the idea of, look, you have to do your own research. You have to come into this 100%. With the idea that in order to have an informed consent, you first have to be informed. And if you're not informed, you're going to have more problems. And what is informed? Well, you're listening to this show. That's the first thing. Yeah. And if you're listening to the Byja radio show and you've made it this far, and I know this is a pretty heavy and lengthy episode, it's showing you're going to be one step ahead of people trying to, for lack of a better term, pull the wool over your eyes.
Thanks.
You're going to have more consistent mindsets of, hey, something don't sound right. Let me go do a little bit more research. Let me make sure that they're not just telling me something I want to hear and it sounds too good to be true. I'm just going to believe it.
Right.
And by doing that, you are then a lot better positioned to have a better outcome. And that's not just on the patient side. Doctors need to do the same thing too. Doctors need to do their due diligence to try to make people feel like they are able to ask questions, have deep, detailed discussions about their medical care, the treatment, the side effects, how much it's going to cost, how long are they going to be out from work. All of these things need to be done in a way where a patient can feel comfortable getting those answers and not you say the patient asks questions, oh, they ask too many questions. Mm-hmm. Like, I don't even know why you would say something like that. Yep. Right? They want too much. Yeah, people can be needy. That's everybody. It's not just certain groups and certain people, or look, they don't understand, so we just going to do it for them because we know better than them. That's not how that works either. You can't do that because that's not how things work, at least not in this country anyway. And at some point, that's going to be a problem. So with that, what we're trying to hopefully get through, and I think Patient Zero will agree, that we here at the radio show believe in doing things that allow you to ethically operate.
Right.
We believe in having the opportunity for you to be informed, and informed in a way that allows you to feel comfortable with your medical choices, and do it in a way that you are going to hopefully get really good outcomes, and more importantly, meet you where you're at. And if we do that and do that well, I think people can agree that we're doing a good job.
I agree.
And Patient Zero, do you think that any of the stuff that we're talking about today is hitting people in a space where, look, this makes sense? Or you think we're at a point where we're just all the way on, the left side of the field, the right side of the field, in the bleachers, and people are like, we have no idea what you're talking about?
I think it has to make sense. You know what I'm saying? Because basically we just spent an hour and some change, or however long, saying that, okay, these people are trying to regulate what's being published, or trying to regulate what type of information is available to you. But these are the same people that allowed all this inhumane treatment and experiments happen not that long ago. So, and what we're also saying is, we understand the reason for the mistrust. And what's funny, not funny, haha, but interesting to me, is the more we do these episodes, it's like my thought process remains consistent. It's like, get all the information you can, do your own research, and make an informed decision. You know what I mean? Like, and when it comes to like media, I think media should not really be, regulated like that. If you should know the difference between facts and opinion piece, and before you accept any of it, you should do your research, and you should look at your own history. But some people are lazy, which, it happens. But, you got to learn what to accept and what not to accept.
Absolutely. And I will also say, and I guess the best way I can say it to make it simple without a long-winded discourse on what it could be. When you come to us on the medical side and say, this is what I heard, this is what I saw, this is what I quote unquote read, the first thing I tend to say, and a lot of my colleagues will say, is show me. Because we are very much doing exactly what you just said. We are trying to do what? Do our own research.
Right.
And the research of you telling me something, I'm not going to discredit it. I'm not going to say what you're saying is wrong. I'm going to say I need to see it first and learn where they got their information, their data from. And then if I do that and find that it's not reproducible, it's not statistically valid, they didn't have a good methodology,
then you're not going to do it.
Then I'm not going to say, we should apply this to everybody.
No.
Now you can do it.
Right. That's
you may literally want to do this supplement, this treatment, this thing at this spa that somebody told you can fix whatever. But if I don't have evidence-based ethical standards to follow, I'm no better than the people on TV who's just espousing BS, right?
Right.
That's just the best way I can say it. So my hope is that you can pull up TikTok, Dr. Google, WebMD, all these places, and come with something. But please be prepared to explain and understand that, look, you have an idea. Let's find the best way to get you the best treatment and not just take something at face value. And if you don't know that I'm going to do the same thing, let me show you. Let me pull the article from the New England Journal or from JAMA or from the American Family Physician or from the British Medical Journal. Because a lot of these things that we are taught, and we're not perfect, never purported to be perfect. A lot of the things we're taught are not going to be things that I just pulled out of thin air. I'm going to be able to say, this is the research, and this research has been vetted and proven. And even if it's wrong, it's been retracted. So let me adjust my treatment. So that's all I think we are trying to get across. And I think direct primary care gives the perfect place to do that because we have time.
Yeah. And that's another thing too. Like as a patient, you don't just take what the doctor says. like you know, once you've built up that trust, then yeah, you can kind of start to do that.
Correct.
But if you have any type of doubt or any type of questions, you ask your questions.
100%.
You don't just sit there and be like, hey, okay, well, I'm not sure about this, but hey, the doctor said it. That doesn't mean anything.
Correct.
So a lot of times you might need to get a second opinion. A lot of times you might need to do some more research. But what happens is when you get that second opinion, or when you do that research, or and you find out the doctor was right all along, then that could build that trust that you may need to go forward with that doctor, you know, and that's like the same. That's like the trust I have for Dr. Jasper, right? You know, at this point in 2025, he tells me something, I'm just gonna take it for face value, right? 2019, I might have not had that trust in him, but he's earned that trust, and I think that you need to make sure that your physicians earn that trust for you, because you don't, you know, that's how you can be comfortable in getting the right care. But it's gonna take work from your part too. It's not just something that you just wake up and automatically have.
Yeah, and from the doctor side, because I think you're speaking exclusively to a patient for the most
Correct.
part, from a doctor side, you got to do the same thing, right?
Yeah.
You can't say, well, I don't understand why they don't want to go and do X, or I don't understand why they don't want to take this medicine.
Yeah.
Have you done your due diligence to build up the trust so they will try it
Right.
and give you the benefit of the doubt, because you've laid enough groundwork to say, I'm not just telling you to take this medicine because it sounds nice.
Correct.
I'm showing you and proving to you the data and the research. Again, why do we like numbers?
Because they don't have an opinion.
Right. So why do you think these journals and all this is really, really helpful? Because a lot of it is just numbers. And if you learn how to read the numbers, you'll say, look, this is not because somebody in this seat thought it was a good idea. That does happen. I'm not going to say it's 100%.
Or I got a gut feeling.
Exactly. Right.
That
or
this might fix it.
Somebody on this social media platform posted this, and you know they got this magical supplement and all this, and I have all the information from different people and different quote unquote doctors across the globe that somehow you can quote, but there's no research under it other than it was in a book.
You know what's wild to me? I'm scrolling on social media. I see more Dr. Sebe remedies now that he's dead than when he was living.
Hey, I'm not even going to go into that, but all I'm going to say is I'm willing to have the conversation, which a lot of people are not. The problem is nobody can give me the actual statistical information.
Yeah.
Now, they can give me stats, but I say, well, where did the study come from? And the first thing is, well, they don't want it to be published. Okay, I'm not saying they did, but can you reproduce it?
I'm just saying, like, look, don't get me wrong. I think the pharmaceutical companies is for profit, and it's a hustle for the most part.
And it can be absolutely atrocious in this country, for sure.
Yeah, 1,000%. Yeah. But I think if, like, CMOS cured cancer, there'd be a lot less cancer out there. I'm just saying.
I'm trying not to laugh at you.
I'm just being honest, though.
CMOS Cancer Center is what you said?
Because there's so much stuff. Like, you scrolling on the internet, there's so many things. Like mushroom coffee makes you healthier. Like, what? What is mushroom coffee?
I literally saw a story which is medically based, medically focused. They said basically a guy had liver damage because he took too many supplements. And why? What was the purpose of the story? They basically were highlighting how the supplement industry is not regulated. So when do you find out that your supplements are really bad? When you come to us.
Right. When something happens to you.
And something happens, right? So you think it's us trying to basically force medicine on you. In a way, it's not me saying you have to take. I'm saying I'm probably going to go with the one that's statistically backed and research proven with the numbers that don't have opinions. Then I saw somebody who had a good commercial. They danced really well. Mm-hmm. And because they had good music, danced well, and had a catchy slogan, let me buy this supplement. And so doesn't want you to know what it's going to be, because if you take this, you're going to kill you and all this. And my favorite thing is, well, do it. Go ahead.
Yeah.
If it's right, prove me wrong. But if you've done it for a year, 2 years, 3 years, 10 years, and it ain't working, when we going to have a real conversation?
Dude, it's wild. Like, and I know this is not a religious podcast. I'm a believer. I just refuse to believe that God put you on this earth, but he made you short of these 70 supplements you have to take every day. Like, I just don't believe that.
I will say that supplements are good. They have a place. but they can't replace simple things. Eating well, exercise, getting rest, all that. Stuff that we talk about, and then we use supplements and medicines together. The problem is people want to put all their stock in natural this and organic that. And I'm like, okay.
I want supplements to like raise my metabolism. But while I'm doing that, I'm going to get this foot-long Doritos nachos.
Hey, I mean, with a side of Skittles, and on top of that, an extra large Coke, and then come to me and say, well, I understand why I'm tired all the time.
Right.
I mean, you telling me that the supplement in this article you read in this random Instagram post on such and such website didn't fix it? Like,
but I take fish off.
What are we doing? What are we doing? That is literally a question. And it's somewhat frustrating, not in a, I'm over here really mad. To me, it's frustrating because you're upset that you're not getting better, but you don't want to listen to the people who are potentially the people you're coming to. Mm-hmm. You're coming to me for my, for lack of a better term, medical expertise, but then you don't want to receive it because you heard, you read, you saw, so-and-so said, and I'm like, well, what you want me to do? You want me to agree with you for your medical expertise, but you didn't do medical training, but because you're smart, I should just somehow, that's like coming to the attorney and saying to the attorney, well, I read this legal brief and I saw Perry Mason and Perry Mason said, and the lawyer like, okay, let's go with that. Let's go with that legal strat. Like, what are we doing? So at this point, I just don't get it.
I saw Time to Kill 7 times.
That's right. At this point, Samuel L. Jackson is the authority. And this is the part that gets me. This is what we're talking about with these state-run government journals. It's like the people who are telling you to do stuff, you're listening, and they have no medical training.
At all.
The Surgeon General right now, from what I remember, didn't finish residency. The person who was nominated to be a Surgeon General, and I'm going off memory, I just glanced at it because I said I can't today. They didn't get full medical training and become the quote-unquote physician. So the Surgeon General should be a, for lack of a better term, board-certified, fully fledged physician, but they're not. And that's the person you're getting medical advice from, right?
Well, hell.
All right. I went to law school.
I might go get some medical advice.
Look, I went to law school one night, read a lot of journals. Why don't you just get your legal advice from me? I got a great podcast, a great TikTok video. And like, what are we doing? And again, if you're listening this far, you're a real one. And we appreciate you. But this is why we potentially get on the quote unquote soapbox. We're trying to eliminate all of that by hopefully getting you to this point of saying they're giving you stats. They're giving you things you can easily look up and reproduce. They're giving you the reasoning why this doesn't hopefully make sense. And you still are going to stand on your side of the proverbial discussion and be 10 toes down. Sure. We're not going to reach you anyway. But if you're willing to have a dialogue and a discussion about this stuff, and we can meet in the middle, and we can both have an achievement where you're healthy and I'm able to do my job, that's what I think this is about. So with that, I think we've been going for a while.
So I have a big announcement.
What you got?
I am now opening the Patient Zero clinic. I'm opening it right next door to the Byja clinic.
Okay. What is your specialty? Let's start there because I think the people need to know at this point.
My specialty is exotic and extreme cases.
Okay. Of
anything.
Of anything. Okay.
Just anything that's like not your common cases.
Okay.
And the reason being, I have the entire series set of House. And I've seen all the episodes twice.
And then you specialized in Scrubs.
In Grey's Anatomy.
There we go. And
I can do it all.
I know you can. And I know on top of that, you are clearly medically trained because you're on this podcast.
Yeah, absolutely.
I mean, there we go.
Between you and Dr. House, there's nothing I can't do.
That's nothing, right? That's why I said. And based on that, I just want you all to know if Patient Zero Clinic is next to Byja Clinic, it might be on the freeway. Because there's a lot of traffic passing by, and you might want to consider where you're going to. I don't know, get your medical care. That's all I'm saying.
I'm just saying, man. Patient Zero.
Yeah. So at this point, again, I think we're going pretty long on this episode, but hopefully, again, it's been helpful for people, especially if you're listening to this. Please like, subscribe, share. We're going to close out. So Patient Zero, quickly, any quick thoughts about today's episode or anything that you want the people to know?
Well, the thing about it is, and I'm going to sound like a broken record on this, but do your own research. And that's on anything, right? There's a reason why I can go pick up a Bloomberg or a Wall Street Journal, and I can still pick up a National Enquirer. It's all fine. It's all media, right? But there's some publications I put my trust in. Some publications I just know it's foolishness, right? And because you do your own research, and that's just what it is. That's the same thing with everything. Whatever your sources are, whether it comes to medical advice, whether it comes to legal advice, as we talked about, whether it comes to investing, whether it comes to whatever the case is, get all the information you can and make an informed decision. Don't just take somebody else's research or somebody else's opinion and take it as gospel. Listen to what you have to listen to, get multiple opinions, and form your own opinion.
There you go. I will close out this part, and then we'll tell people where they can find us by saying we are very, very mindful that the topics we go over are meant to possibly make some people uncomfortable, but it's to make you and me and the listeners better. And if we can do that in the right way, where we strike that fine line between giving you information that you may not want to discuss or hear, but then it allows you to open your mind to something different.
Correct.
And expand your knowledge, expand your ability to accept other people, expand your ability to be in the room and have conversations that may and truthfully move things forward in society and medical care. Then dag-nabbit, since it's a family show. Dag-nabbit. We're doing something right.
Yeah.
And that's what I'm trying to get people to understand. We're literally 3 seasons in and just picking up momentum. And with that momentum, we're going to keep doing this. And it's going to happen to where people are going to say, I heard this, let me have a discussion. I heard this, let me look it up. I heard this, now I'm better informed to be better, healthier, smarter, more ethical in my doing. Mm-hmm. And I feel like this is what it was intended for. It wasn't them just basically saying stuff that sounds nice, exhilarating, and again, it's clickbait. They're saying stuff that hopefully people will listen to, latch on, and say, man, I didn't know that. I looked it up, and that really and truthfully changed my perspective. So I appreciate y'all. And again, we appreciate you. So at this point, Patient Zero, where can the people find you?
They can find me at on Twitter or X, at George_Becnel. They can find me on Instagram at Becnel Media. And you can also find me at LinkedIn at George Becnel II.
All right. As for us, we are Byja Clinic, www.byja.org, byja.org. We also can do www.byjaca.org for Byja Charitable Alliance. That's our nonprofit organization. If you're interested in making a tax-deductible donation, please visit that website, click on the link, and you can become a one-time donor or a monthly donor. It all goes to a place of helping people like the people in today's episode get care that is equitable, ethical, informed, and obviously affordable. Lastly, you can find us on social media. We're on Facebook, LinkedIn, and Instagram. And you can also catch us at next week's episode. And why am I saying next week? Because it is the season finale, brother. Season finale, okay? I'm just going to say, if you're listening to this point, I don't want you to come with really high expectations. I like the bar being low. So when I surpass your expectations, you're blown away.
Yep.
Because when people hear season finale, they're thinking, oh my goodness. Again, let's not do that.
Yeah.
Let's not do that. Why? Because again, if at this point you want the season finale to be awesome, but you haven't liked, subscribed, shared, commented, or given us a positive review, I mean, what do you want us to work extra hard for and you not? I mean, it's a two-way street.
Yep.
That's all I'm saying.
And then you haven't asked us a question.
Yeah.
Engage with us in any type of way.
Right.
Come on, man.
A few people can do that, right?
Right.
And those people are probably, we can count them on two hands. But if you're not those people, I mean, you got a ways to go before we get to that season finale being, the most magnificent thing ever. So,
Thanks.
Nevertheless, we're going to get off our soapbox. So we appreciate you for listening to this and listening this far. We will see you next week. Thank you.